most of the people are actually, they don't know the difference between psychologist and psychiatrist. So I think if you
Okay.
can clarify the difference between the two in terms of training and treatment.
A psychologist is generally a doctorate level provider who has a PhD or a PsyD. A psychiatrist is an MD, a physician who can prescribe medication. A psychologist is generally someone who does psychotherapy, and a psychiatrist is generally someone who does psychiatric medications and who can also do psychotherapy.
And I think this is actually a question that, I want to know from you, that you have been into this practice since 20 years, right? And that's a pretty long time. So how do you cope up? Because you're a mother and, as you said, your kids take a lot of time, then your horse also takes
Yes.
time. So how is it that you connect emotionally with your patients? Because I think this is a very, as you grow in your life, you become more deeply connected to people. So how do you manage and how does it? Like, please let us know about it.
Empathy. I think, and the more life experience I get, the better I can connect with people. So the more things I go through in my life, the easier it is for me to relate to what someone else may have gone through. I think empathy is so important when you're doing mental health. If someone has had a difficult time, putting myself in their shoes and imagining what that may have been like, I think it's so important to try to connect and not over connect to the point where you kind of lose yourself and lose your ability to think objectively. But I think that's really what everybody wants is for their doctor to really try to relate. I do think that's the benefit of seeing a female provider who's a mother, and who's had a more experience is that I have been through quite a bit in my life and can relate to a lot of people.